right, guys, now we have some important things to discuss. How often do you floss? Are you still brushing your teeth every day? And do you have healthy gums? Well, I'm not going to ask you that, but we have somebody here that is going to ask, and if you aren't doing those things, he can help you out too. This is Dr. Chris Doan from Aspen Dental. Thank you for talking with us this morning.
Thank you.
I know I put everybody on the spot. When's the last time you flossed, right? Because sometimes we forget to, or we don't do it near enough, and it can affect our overall body.
Yes, it can. People who don't floss and don't brush their teeth properly, they can develop tooth and gum infections, which can actually become systemic infections. There was actually a boy in 2007 in Maryland who died of a tooth infection. So. Oh,
that's awful. Of course, we don't want that to happen, and it can be avoided if you just brush and floss those teeth. Okay, let's talk about Aspen Dental. What do you guys do?
We do all comprehensive dentistry.
I thought so.
We do everything from dental implants to simple fillings. And we do dental cleanings and anything to do with dentistry.
Anything to do with your teeth, I thought, I don't know. I just want to make sure I'm covering my bases. Anything that has to do with your teeth, whether it's a cleaning, maybe there's a crack or it just hurts, you can help, isn't that right?
Yes, ma'am.
Okay, but we're talking about something very specific today, and I see you brought me a little display. We're talking implants. What is an implant? Why would somebody need one?
A dental implant's a titanium screw, basically, that goes into the jaw, and a crown goes on top of it, and it is really the best solution for a missing tooth.
Okay.
So, it's a permanent solution. 95% of implants that were placed 20 years ago in America are still in people's mouths today.
So you get it once and it is going to stay there until the last day. That's good to know, because you need that. You have to make sure that nothing is coming out in the middle of eating an apple or something like that. But why would somebody need an implant? If you're missing a tooth, maybe you have a rotten tooth, what's leading up to needing an implant?
So, if you have decay and it goes too far, then it can become an infection, like an abscess. And at that point, you either have two choices: to get a root canal and a crown, or to get the tooth extracted. If you get an extraction, a dental implant is really the best way to replace a single tooth. A dental implant replaces a tooth and allows you to chew in that area again. People that are missing teeth that don't have a way to replace them end up developing digestive problems because they can't chew their food properly, and it becomes more a systemic problem at that point.
This really becomes a much bigger problem than I have a toothache or I need to fill a tooth in where there might not be a tooth. There's a bigger picture here. Yes,
ma'am. If you don't have teeth to chew with, really the mouth is the gateway to the body. If you don't have teeth and you can't chew, you can't smile, it leads to bigger problems.
Well, let's talk about some of your patients that you see that come in that need an implant. What kind of problems do they often have? What's, I guess, a common one in San Antonio?
Periodontal disease, gum disease. People that have not gone to a dentist in many years, they'll come in and they'll typically have a lot of buildup on their teeth, and their gums will be very inflamed, and sometimes that can lead to loose teeth, and basically at that point those teeth have to be extracted. So dental implants can come in there and replace the teeth, and actually dentures can even attach to the implants. Oh. So that's pretty cool.
You know, we actually have a picture of periodontal disease. You just finished telling us about that. Let us know over time what that is, maybe some signs that you might have it if you don't know you do.
Periodontal disease is when you have a chronic infection in your gums. Your gums become red, they bleed, and typically you might even have really bad breath associated with that. So you can get a deep cleaning that will help cure a lot of that. But if it goes too far, then the teeth become loose, and then you're looking at bigger problems.
I think it's a common message right now is that there are some big problems, and sometimes somebody would think, or at least I would think, well, of course you brush your teeth every day. That's what you do. You need a floss. But there's actually many people that don't take care of their teeth the way that they're supposed to. Many Americans, I'm seeing here, 47 million.
Don't have dental care. Yeah. So it's a big problem. At Aspen, we actually do a couple of days a year where we treat people for free here in San Antonio.
Oh.
And we have another day where we treat veterans for free. So we really try to give back. And there's a certain percentage of the population that I see in San Antonio that come in, and it's not a special day for us or anything, and we do free dental care occasionally. So.
That is so nice of you guys. Well, I'm going to put you on the spot for a minute. Do you happen to have some of those dates, or maybe you can fill us in later and we can share with everybody?
Yeah, we can fill you guys in later. We have a Veterans Day coming up, and then we have a couple of days a year where we do a mouth mission day where we just treat people for free. So
that is really nice of you, because sometimes some folks need that extra help, that free help to ensure that they have a healthy mouth, and that's what you guys are all about. Guys, I want to leave you with some more information on how you can go see Dr. Chris and make sure that your gums are healthy, the teeth are healthy. Maybe you need a transplant. He can help you. It's at aspendental.com. Okay, they're also on Facebook. Go and like them. All the information is there. And you guys do social media, of course. Go and like them and follow them on Twitter. It's at Aspen Dental. All right.